Major breakthrough in the fight against Alzheimer's. The FDA gave the green light last week for a new blood test that could help diagnose the disease earlier and more accurately than ever before.
Our 9 News health expert, Dr. Payal Kohli, is joining us now to help us understand what this means for patients, families, and even those without symptoms. Dr. Kohli, good morning.
Good morning. What a breakthrough, huh?
Absolutely. What do we know about this new test?
Yeah, so we've been waiting for it for a long time. And essentially, as Corey said, it's a blood test. It's FDA approved. And the idea here is if you're over the age of 55 and you're having any kind of symptoms of cognitive decline, this measures two proteins in your blood. One is called p-tau and one is called beta amyloid. And the ratio of the two proteins tells us whether you're putting down these plaques or deposits in your brain that can lead to Alzheimer's disease.
Should healthy people get checked?
This is $1 million question. So the answer today is no, absolutely not. If you're healthy, all you're going to do is create worry for yourself. It's possible that the test will be positive before you start having signs and symptoms of memory loss, but there's not really much we can do because unless you're having those symptoms, we don't even really start treating you for Alzheimer's. So getting it as a healthy person, all it's going to do is generate worry. Now, in the future, I'm hoping that we get to the point where we start screening people kind of on a population level. In fact, what we're actually looking for in the medical community is just like we check your cholesterol every year, we check your dementia tests every year and start to say, okay, now you're becoming higher risk for dementia because of these markers. So you need to change your lifestyle and exercise more and sleep better. And you could actually change those numbers based on that test.
How do we currently diagnose Alzheimer's and how accurate is that really?
I mean, it's not at all accurate. So the Alzheimer's Association tells us that of symptomatic people out in the community going to their doctor, 50 to 70% of them are misdiagnosed with Alzheimer's. And if you go to an Alzheimer's clinic, that number is still pretty high, 25 to 30%. And so what we use are kind of a combination of factors and say, okay, how likely is it based on all these factors that you have it? Obviously, your kind of memory and some memory tests and such, but we do spinal taps, we do brain imaging, really invasive, really expensive ways to diagnose Alzheimer's, which then still end up being largely inaccurate.
Yeah. What impact will this test have on caring for patients with Alzheimer's?
Honestly, guys, this is a game changer. I mean, this is going to be a tremendous impact and on so many levels. So first, as you said, earlier diagnosis more accurately. So if you start to think about protein deposits in your brain, the earlier that you could start to reverse those with treatment, the better the prognosis, because once they start sitting for a long time, they become irreversible. So diagnosing people earlier, getting them into clinical trials, getting them on treatment earlier, I think that's really important. Monitoring the treatment over time as well. So a lot of the new treatments for Alzheimer's take these plaques out of the brain. So watching the levels of this blood test over time and seeing how you're responding to treatment without necessarily having to put you through expensive tests. And most importantly, I think ruling out Alzheimer's. So to me, that's called a negative predictive value. If the test comes out negative, it gives you peace of mind that your memory issues aren't related to Alzheimer's, which of course we all worry about as we age.
And that begs the question, of course, even if we are younger and healthier now, but we have dementia that kind of runs in our families. What can we do now to protect our brain health?
So important to start thinking about it in your 40s and 50s, because what we're learning is that dementia is largely preventable. In fact, the most common causes of dementia, which are something called vascular dementia, the small blood vessels in the brain getting plugged up, largely preventable. So Alzheimer's is a little different because it's genetic related and such, but you can prevent dementia by doing all the right things that keep your blood vessels healthy. So I'm talking about not smoking, exercising, eating a good Mediterranean diet. Certain types of foods that are rich in omega-3s can also reduce your risk of developing dementia. And something that we take for granted, but actually socializing, even as an older adult, and making sure that we sort of stay connected to others. This has been associated with a lower risk of dementia, and then getting our hearing checked. I worry about this a lot with young people who wear AirPods all the time.
All of us who have IFBs in for 5.5 hours every morning.
Because we don't even think about getting our hearing checked on a regular basis. We just start cranking the volume up on everything. So even, start screening for hearing loss in your 50s, which is what we're supposed to do, because that can really increase your risk of developing dementia.
Oh my goodness. That's kind of scary because we do use this all the time.
5.5 hours every day of every weekday of this in our ear.
Wow.
Well, so keeping those volumes in check,
This is why I signed you up for the half marathon. Exercise is so important for, staying healthy. You're welcome.
Thank you.
So one day when you're healthy and don't have dementia, you can thank me.
Okay, thank you, Miss Corey Rose. By the way, this is why I endorse a Golden Girls lifestyle. When we're older, the kids are out of the house, we're all moving in together. It's for our brain health. It's not just
Right.
because
Relationships.
I want to bother
Can I have the
everybody.
master bedroom?
Yes, you come on in. You come on in. Exactly. Dr. Coley, thank you very much. By the way, you have the news in your ear. I've got the latest Tupac.
Oh, nice.
The new releases that they did not put out back in the 90s. You can find all of Dr. Coley's appearances at 9news.com/Dr. Coley.